Welcome to Learn at Work, a webinar series by the journal Work. Work is published by iOS Press in the Netherlands. I'm Karen Jacobs. I'm the founding editor of the journal, and I'll be moderating today's webinar. It's with great pleasure that I turn this webinar over to our speaker, who will introduce herself and give you some background on herself before discussing her. So welcome.
Thank you, Dr. Jacobs, for that kind introduction. My name is Bhibha. I am an associate professor of kinesiology at East Carolina University in beautiful Greenville, North Carolina. I have a background in public health and physical activity. I have an undergraduate degree from the University of Illinois in molecular and integrative physiology, a master's in public health. After I received my master's in public health, I worked for several years in the field of public health as a public health practitioner, first for the state of Illinois, the Illinois Department of Public Health, and then next at Human Kinetics Publishers in Champaign, Illinois. During my time as a public health practitioner, one of my greatest frustrations was seeing the lack of translational research put into community-based settings where a great deal of that work can be done. We know that physical activity is good for us. We know the benefits of it, yet only 20% of us meet physical activity guidelines when we were thinking about U.S. Adults. And that was one of the major impetuses for me returning back to my alma mater, the University of Illinois, to obtain a doctorate in kinesiology and community health. After I obtained my doctorate, I ended up going down to the University of Georgia in Athens to complete a postdoc. And while I did my postdoc in an exercise physiology lab, I again worked a little bit more on the importance of physical activity in work sites, which is how I've become involved in work and which is involved and informed some of the research that I have conducted while a faculty member at East Carolina University. So today I have the great pleasure of talking about a study that was published in Work recently. It's called Nurses Physical Activity Exploratory Study, Caring for You So You Can Care for Others. My graduate student, Brianna Clemens, now Adams, this was part of her thesis, and she is currently working as an independent health coach. We collected this data, just for full disclosure, we collected this data in fall of 2015 and spring of 2016. So clearly before the COVID pandemic. And because of that, some of the things that I will talk about and mention will have more impact and meaning because we know a lot of the burden that our healthcare providers have faced in the last almost 2 years of the pandemic with differing surges across not just the US, but across the world as well. So just to give you a little bit of background of the work. We know that nurses, based on their training and expertise, have significant knowledge of the importance of physical activity, which will be denoted as physical activity moving forward. However, nurses do report low health status and engage in little physical activity. A study that was done in about 2016 showed that less than half of nurses engaged in any leisure time physical activity. So we're talking about leisure time physical activity. We're talking about physical activity outside of their occupational work hours. Nurses also, and again, I think these numbers have shifted significantly and gotten higher during the pandemic. Nurses report the greatest stress of all healthcare workers. And that stress is because of three major things. Nurses have a unique skill set where they don't just have mental burden, where they're thinking intellectually and thinking about their next steps and, how do I have a treatment plan for this patient? But they also have emotional and physical burdens as well. For a lot of our nurses, especially in the healthcare system that we have within the United States, nurses provide a lot of emotional support for their patients. Oftentimes you will see a physician or other healthcare provider come in, give the news to the patient and the patient's family, and it's often left to the nurses to provide some type of emotional support and relief. And just to give you a little bit of a personal story about that, my mother was recently diagnosed with cancer. She was actually diagnosed with cancer in April of 2021. So during the pandemic, and she had to have surgery as part of her cancer treatment. And her doctor, I cannot say enough good things, the doctor saved her life. But her nurses were the ones who really provided a lot of emotional support for my mother when she was there alone, because it was during the pandemic. So she wasn't able to have family with her throughout her stay. So the nurses provided a great deal of emotional support to her. But also the third burden that nurses face is the physical burdens, the physical demands of the job, of moving a patient, taking a patient, like my mom, for example. My mom had significant surgery and was healing. So the nurses helped my mother get from her bed to the bathroom, helping her walk around a little bit on the floor. So our nurses, as I said, face three significant burdens. They've got emotional burdens, where they are providing some of that emotional support to patients and their families and caregivers. They have the mental and intellectual burden of just the actual job that they're doing, and then the physical burden of being there and providing an additional level of physical needs to their patients. And we know repeatedly that physical activity is associated with health benefits. We know that physical activity, habitual physical activity, is not just beneficial for good health, but it's also beneficial for chronic disease prevention and chronic disease management as well. But because of the unique nature that nurses face in their occupational lives, they have these other stressors that other occupationals don't typically encounter. For example, compassion fatigue, burnout, and we hear about burnout a lot now, especially with COVID-19. But COVID-19, a lot of what we saw was in nurses compassion fatigue, general fatigue, pain, and that burnout concept. So just again, some more background for you. Physical inactivity, workplace stress, poor sleep quality, especially our nurses who may be working in hospital settings and be working on shifts or swing shifts where 1 week they're working 12-hour days and then the next week they're on 12-hour nights. That can impact their sleep quality. Fatigue and burnout, that can really impact a nurse's health status, which then can lead to decrease in quality of patient care and increase in staff turnover. And this is especially important as we're going through the COVID-19 pandemic, when we're seeing healthcare workers and nurses particularly who are very burnt out and frustrated because once they've got one surge done and managed, there's another surge that's coming up, and it really impacts their empathy. It impacts how they feel about not just their jobs, but how they feel about their fellow colleagues, society as a whole. So because of this, it is really important for nurses to identify techniques that may be low cost, low resource for stress management, because we know these stressors can really negatively impact their health and ultimately patient care, which for a lot of healthcare providers, hospitals, that's the endpoint for them. And so it's really important, again, not just to care for the nurses, which I think is incredibly critical, but also how do we reduce hospital errors, medication errors, and improve quality of care for our patients long term. So the objective of our study was to examine the relationship between physical activity levels and physical, mental, and occupational health among the nurses. Our hypothesis was that nurses who were physically active have better levels of physical, mental, and occupational health compared to inactive nurses. So we collected data from 62 nurses. These nurses completed measures of anthropometrics, so we got height, weight, waist measurements, hip measurements, demographics. So questions that we asked were, how long have you been in the nursing field? What type of facility do you work in? What's your typical, what type of facility, what type of shift do you have? Are you typical 8 to 5? Are you day shift only, night shift only, or swing shift? And then we asked about domains of physical, mental, and occupational health. Our statistical analysis was done during Pearson correlations to examine the relationship between physical activity and measures of health, along with the relationship between physical activity and health among active versus inactive nurses. So we looked at this population as a whole, and then we split the population based on active and inactive nurses. And the way we shifted inactive versus active nurses is we actually used the 2018 Physical Activity and Public Health Guidelines. So that's what we use to determine if a nurse was active or not. And for those of you who are not familiar with the U.S. Department of Health and Human Services guidelines for physical activity and public health, our guidelines say that to meet guidelines, you need to do at least 150 minutes of moderate to vigorous intensity physical activity per week. And if you're not familiar with the physical activity literature, you may be asking, well, what is the difference between moderate and vigorous intensity activity? Moderate intensity activity is if you're walking late to a meeting, if you're walking to an airport to catch your flight. I like to use the talk test when I'm teaching this to my students. If you can talk but not sing, that's moderate intensity. If you can't sing, that's vigorous intensity. So you really want your heart rate to be going up. And so that's how we've defined physical activity and meeting guidelines for inactive versus active nurses. So I just want to look and show you a little bit of the results that we had. As I said, we had 62 nurses, I should say, who were in our study. Average age was about 42.2, and as I tell my students, I teach physical activity and aging actually for our department, and as I tell my students, the older you get, the younger 40 looks, and so 42, relatively middle-aged, relatively young population. The BMI was about 28, so for those of you who are not familiar with body mass index, a normal healthy weight is considered a BMI of 18.5 to 24.9. 25 to 30 or 25 to 29.9 rather is considered overweight, and then anything above 30 is considered or classified as obese. So you can see for the most part, most of our nurses were in the overweight category. 98% of our nurses were female, which tracks fairly historically with nursing trends in the US. 85% of our nurses were white or Caucasian, again, which tracks a lot. Again, the study was done here in Eastern North Carolina, so that tracks quite a bit with the population that we have here. 55% of our nurses had a bachelor's degree or higher. And that's because in North Carolina, like many other states in the United States, you can be a registered nurse with a 2-year associate's degree and passing the clinical exams, the certification exams. So we had 55% higher, 69% were married, 69% had children, 68% were employed by a hospital. Nearly half of, or over half of our sample, I should say, did some type of shift work. Nearly a quarter did what we call shift switching. So again, that was where one week they were on days and then the next week there were nights and so forth. Nearly 30% were required to work overtime. And I'm sure these numbers have increased as we've seen during the pandemic. And then 44% had been in the nursing profession for over 10 years. So that's a little bit about the broad demographics that we have there. The next thing I'd like to show you is just the overall results. So again, we had taken the sample as a whole and then looked at our sample between active versus inactive. And our sample as a whole, you can see about 9,000 minutes they had as a whole. They were taking about 9,000 steps a week. their moderate to vigorous intensity, and we measure our moderate to vigorous intensity using a Fitbit. So like I said, the study was done in fall of 2015 and spring of 2016 is when Brianna collected the data. So Fitbits were relatively new on the market as an activity tracker, and so we used Fitbits then, and I'll talk a little bit more about some of the pros and cons of activity trackers towards the end of the webinar. Fatigue was about 10.1, higher levels of fatigue. The higher the number, the higher the levels of fatigue. Sleep quality was poor, moderate to pain intensity, moderate pain interference, high levels of stress, okay quality of life. Burnout was very high, about 84. This was on a scale from 0 to 100. Again, I'd be very interested to see what that looks like during the pandemic or post-pandemic. Compassion satisfaction was about 44.6, and secondary traumatic stress was about 20, so on the low end, and burnout was about 19, so on the higher end there. The next thing I'd like to show, which I think is really some of the novel pieces of what we found, were the correlations between activity levels. So we decided to break down our activity levels, as you can see on the left-hand side, by steps, light intensity physical activity, moderate intensity physical activity, vigorous physical activity, and then anything that really fell in that category of MVPA, where sometimes it was moderate, and then within that same second or minute, it would change into vigorous intensity. And the Fitbit gives you that data, which is really exciting. So some things to really, that I'd like to bring your attention to for you to look at is the role that light intensity physical activity has. And to me, I think that's really innovative and exciting, because oftentimes what we do in the physical activity / fitness exercise world is we sell this concept that you have to be at a fitness facility, or you have to be doing CrossFit or some high intensity activity to get health benefits. And to me, what our findings demonstrate is you don't. You just have to do something. And that's really exciting to me, that some type of movement can actually have some benefits. So if you're at a stage of your life where, you know, being active, whether it's due to an injury or pain or time or level, and you can't do a CrossFit workout, or you can't do a cycling class because you don't have the ability, that's okay. Physical activity is still going to be beneficial for you. And we can see that with our light physical activity, where there was a result demonstrating that people who did some forms of light physical activity actually improved their quality of life and improved their burnout, which I think is super exciting. And then when we look at moderate physical activity, we also see that for quality of life and for burnout. Then when we look at vigorous physical activity, it helped with your pain intensity. And then when we looked at MVPA, it helped with sleep quality, pain intensity. So we know there's some relationship between those levels of physical activity and occupational health outcomes. So to me, that's really exciting to look at and see that even if your lifestyle and your journey doesn't incorporate or allow for moderate or vigorous physical activity, even doing some type of activity is beneficial and can have great health benefits, but more importantly, have quality of life benefits as well. Again, this was a correlational study, so that's a limitation, and we did have a small sample size. I would be curious as a researcher if we had a larger sample size and if we did this actually post-COVID, what that looked like, what those findings looked like. So just some discussion measures to look at and think about as we go forth. Nurses who had higher BMIs were less active than nurses with lower BMIs. Active nurses were less fatigued, had lower levels of stress, had better mental health, and lower levels of occupational burnout than inactive nurses. Notably, these benefits were shown even with light intensity activity. nurses do need to increase the intensity and duration of physical activity to see more health benefits, and that's just a recommendation even I, as a physical activity researcher, would give to the general population. But because our nurses are in such a unique situation and do such important work, they may see these benefits at stronger and higher levels than the general population. Our study had some great strengths, in my opinion. First of all, we did have an objective measure of physical activity, and that's because we had people coming into the lab to look at that. As I mentioned, we did use a Fitbit, and we used the Fitbit that was available in 2015, which was one of their more initial models. Fitbits and activity trackers have changed exponentially in the last 6 years, 7 years. In fact, I think I saw something, the American College of Sports Medicine, my professional organization, actually recognized activity trackers as one of the greatest fitness trends in the last 5 years. It's been in the top 10 in the last 5 years. We have different types of activity trackers, and they're very commercially based. 5, 6 years ago, it was really only in a research lab or setting where you could get Fitbits and Garmins. Now they've become commercialized, and we can really, the average person can get them. So if I were to do this study again, I would probably use a Fitbit or a Garmin, and maybe even an Apple Watch, because more people are familiar with that because of the commercialization of what is out there. We also included nurses with 1 year of nursing experience, and we did that because we wanted to make sure we didn't get any new people who may not have experienced quite the challenges and triumphs of the nursing profession as a more seasoned nurse. So some limitations that we had. Of course, we had variability in our demographics. For example, a number of hours that worked, shift time, different stress factors. People who said that they worked on a critical care unit in a hospital reported different stressors than someone who was working as a family medicine or a public health nurse. Obviously, that has changed and shifted during COVID-19, but at this time in fall 2015, spring 2016, that's what we saw. We also had an underrepresentation of men. You'll see that 98% of our sample was female. Nearly 90% of our sample was also white. So if I were to do the study once more, I would have more men, be more intentional in recruiting men, and be more intentional in recruiting people of color. Again, this was a correlational study, so that is its limitation on its own. We had sample size. Even though we had 62 people, the sample size is still relatively small, and people self-selected. So people who were interested in physical activity and health were doing this type of research, or at least involved themselves in this research. So some future research directions to look at. Of course, we want to control for variability of demographics. So I would try to get a larger sample size and a more robust sample size across different demographics, such as shift time, where they worked, different stress factors, recruit more men, more people of color, and larger sample size. Some practical and conclusions from this is that we know stress is prevalent among nurses. We know that it impacts a nurse's health along with their patient care, and so our findings suggest that health benefits are associated with physical activity among nurses. Even more novel is that it doesn't have to be moderate to vigorous physical activity. Even light intensity activity can have beneficial impacts on our nurses. Some implications from a practitioner real world example include hospitals, healthcare facilities, doctors' offices, especially after this COVID-19 pandemic, should really consider investing in their nurses' health. Not just their physical health, but their emotional and mental health as well, which we know physical activity can positively impact. So these facilities should consider developing interventions that are needs-based, so asking the nurses themselves what they would like in a physical activity intervention, implementing those interventions, and then evaluating what works. And having opportunities worksite based would be beneficial so that nurses don't have to leave to get their physical activity. If there was a place where they could be active or engage in physical activity types of interventions, that would be beneficial. That would help, obviously, their physical, mental, and occupational health, and help with their patient health and safety. So that is all I have for today. That's my contact information. You can follow me on Twitter or connect with me on LinkedIn. I'm always excited to talk about physical activity and public health implications, but I appreciate everyone's attention today.
Thank you so much. This was so interesting, and I have so many small questions for
Absolutely.
you. You know, I'm very fascinated by, having the nurses have a place where they physically are located for this mental health and physical health. Do you think that we'll see employers implementing something like that? So it's going to take up space, or adding more wellness activities, yoga, Zumba, things like
I
that.
hope so, Karen. I know it takes up space, and I think it's one of those things that we need to see the forest through the trees, where it's short-term pain for long-term success. We know that, and we're seeing this, right, with the Great Resignation with COVID-19, that employees who feel valued and appreciated are more likely to stay at their organization. And I'm thinking about a healthcare facility like a hospital, for example. A lot of hospitals already have physical activity and exercise equipment for their cardiac rehab patients. So when their cardiac rehab patients are not using that equipment, a lot of places that just sits empty. So why not allow their employees to use that equipment? Have a very simple sign in, log in. We use badges to log in everywhere. And anyway, why are we allowing these healthcare facilities, hospitals in general, to let this cardiac rehab equipment just sit? That would be a great opportunity. Or why not allow nurses to be active alongside the patients that they care for? I think that would be a great way for hospitals to demonstrate they care not just about the patient's health and well-being, but they care about their employees' health and well-being, to really demonstrate that they are a pillar of the community and a role model for health and regional transformation.
I love that. I think that's a brilliant idea. But that works only in a hospital or rehab where they have cardiac activities. We may not see that in some of the other facilities where nurses may be working, but I think it's a great first step.
Absolutely. I mean, I don't think we can have a one size fits all, but there are definitely ways for us to start thinking innovatively about how to incorporate physical activity in the places we already go to day to day.
Yeah, I love that. I love that. Tell me a little bit more about using like a Garmin watch, or any other wearable technology. What that was like for your nurses. And I think you mentioned this already, but could you tell us what was actually measured on a watch?
Absolutely. So we use the Fitbits, and the Fitbits originally, the way Brianna set it up, is because they were our lab Fitbits. Each nurse, if you will, or participant, had a Fitbit that was assigned to them. And we could go back on our back end and collect the data once it was synced. And we collected all the intensities of physical activity, but we also collected some sleep data that I didn't report here, but we did collect some sleep data as well. So that is what we collected from the Fitbits for Brianna's thesis and for this manuscript. Talking about the Garmins, and so again, keep in mind this is 2015, 2016, wearable technology wasn't as on trend. At that time, some of our participants were a little skeptical of the Fitbits, to be quite honest with you. I'm not quite sure what was getting tracked, didn't really feel comfortable having to charge their Fitbit every few days so that we could get the data. We'd ask them to wear the Fitbit for 1 week. So that was different for them. But I believe in 2021, where activity trackers are so prevalent and common, that our nurses and any other research participant would not feel uncomfortable doing that. I'm running a study right now looking at a physical activity intervention in Black women, and we're using Garmin trackers, and many of them are upset that we're asking them not to wear their own personal activity device, but to use our lab's physical device because they already have a Fitbit or an Apple Watch or something else. And for them, it's not the discomfort of wearing the watch, it's the discomfort of wearing something that we're asking them to wear.
Well, it's so interesting. And the reason I mentioned the Garmin, we're going to initiate a study also that's looking at working from home. And we're giving the participants Garmin watches. And our study is going to go much longer than just a couple of weeks. And we're going to look at sleep and heart rate and a whole bunch of other aspects. So I'm just so curious to know what app are you using with the Garmin? Do you have an app that's
so? We are not using an app. We're actually doing it old school. So we're using the Garmin vívofit 4. It's the Garmin watch that we're using. I'm actually just looking at the one sitting on my desk right now. And we are asking participants to kind of do it old school, where we have a form that they fill out every day. And because they're coming in every 2 weeks to get other measurements done as part of our study, our research team will go back and look at the data from previous days as well, just to do some confirmation.
Oh, great. Well, it's interesting because the process you're doing is experiential sampling methodology, and I don't know if that's how you're approaching it in looking at how you're collecting the data. And it's something that I actually did with my doctoral work, and I was so interested when you mentioned, things have changed with activity trackers from 2015. I did my doctoral work a long, long time ago, 1990s, and I had people wearing Casio watches that I had pre-programmed to beep them, and then they wrote something down, and they were beeped 7 times a day over an extended time period. So it's interesting how the same methodology is being used where technology is enhancing the use.
I think it's fascinating, Karen, because I started here at ECU in August of 2013, and with my startup package, one of the things I bought was the pedometer, an NL1000 pedometer. No bells and whistles, very unsexy. You put it on your waist, and it tells you MVPA, and it tells you steps, like just very, very basic stuff. And I was just joking with a colleague when we were getting all of these vívofits ready for my study. I was like, all these I've got 100 NL1000 pedometers, and no one wants to wear them because they don't have the bells and whistles, but it does tell you how many minutes of vigorous intensity activity you get, but it's not sexy or desirable to the average everyday consumer. So I do think it's interesting. So I'll be curious to see how the field evolves in the next 15 to 20 years with our technology.
Absolutely. And I love technology, and I love innovation. So it's been really interesting to watch how it's changed. Well, I want to thank you. This was so interesting, and COVID has really made a difference in our healthcare workers and nurses in particular. And you address that with the need for employers to really look at, how can we keep our healthcare workers or nurses in particular healthy. And I hope people read your article. I hope that your future studies, you mentioned some of what you're going to be doing differently in the future. I wish you my best in these future studies. So thank you for publishing in our journal Work and for being such an active participant.
Thank you so much, Karen, and I hope you have a great rest of your day.
Thank you. And thank you, everyone, for being here and listening to this Learn at Work webinar. Take care.